can have this campaign where we bring in the traditional healers, tell them about epilepsy, how to recognize it, and refer the patients early and bring them in even in the awareness campaign, I think we can work with them. It's a very good opportunity that we have.
I've had somebody ask me if epilepsy was catching, and somebody told me that putting a metal spoon in my pocket would prevent seizures. Unfortunately, in 2025, these types of questions and beliefs are not rare occurrences, especially in low to middle income countries. And so, thank goodness, we have strong, passionate, knowledgeable neurologists like Naluca Beckford from Zambia. Naluca is working with local communities to educate and promote treatments and seizure prevention methods that are scientifically proven, and working with politicians to get them to implement the IGAP, the Intersectorial Global Action Plan on Epilepsy and Other Neurological Disorders. Bit of a long one. If you're new and you haven't done so already, please do like and comment on this episode and subscribe to our channel so that we can get more people learning about and developing a factual understanding of the epilepsies.
Thank you for having me, Torie. So I'm Naluca Mwendawe-Beckford. I'm from Lusaka, Zambia. I'm an adult neurologist and head of neurological services at my institution, the Levi Mwanawasa University Teaching Hospital. And I'm also the Secretary General for the International League Against Epilepsy Zambia chapter.
We're just 1 hour away from each other and time zone wise, which is really cool considering the geographical distance. So tell us about what it can be like to have and to treat people affected by the epilepsies in your country, because I know it's quite a limited resource sort of setting in general.
When we look at Zambia, we fall in the bracket of low to middle income countries. We're just in the central southern part of Africa, and Zambia is actually landlocked. We are surrounded by very wonderful countries or neighbors, so we don't have access to the ocean. We have our own local beaches because we have a number of water bodies. We house the mighty Victoria Falls.
Well, I have to say, officially, I'm a fan of that name, so that's so marvelous.
With that aspect of us being in the limited resource settings, it's quite a challenge because we don't have access to the diagnostic tools and treatment options that our friends have in the high income countries.
How does this limit your treatment and care for people with an epilepsy in your country?
We have a few drugs available. Commonly, we still have some old drugs like phenobarbital, carbamazepine, and sodium valproate. These are accessible in our public health institutions. And now we are having some access to newer drugs like levetiracetam. However, this is just in the urban areas, and not all urban health institutions have that, maybe just the tertiary hospitals. But in the private sector, when we look at privately owned pharmacies and institutions, they have some fewer anti-seizure medications that we don't have, like topiramate, lamotrigine, are available. But on a large scale, we still have the old drugs, phenobarbital, valproate, and carbamazepine. That's what we still use, unfortunately.
And what about access to surgeries, for instance? Is that ever seen as a treatment for people?
Unfortunately, Torie, we don't do epilepsy surgery. I'm a very positive person, and I know in future we can have that. We just have to have our neurosurgeons interested.
Even just speaking to yourself and hearing about your country, I mean, if anybody's interested, I say get over to Zambia, really. And because we were talking about you yourself being an epileptologist, and there are very few in your country.
Well, at the moment, there's just one epileptologist. I'm not yet an epileptologist, but of course, I will be going for my epilepsy fellowship in Cape Town, South Africa. So we only have one epileptologist, but we do have about 17 neurologists now. So before 2018, we only had about 3 neurologists who were expatriates, but in 2018, we had the local neurology training program here in Lusaka, Zambia. And so we've graduated 18 neurologists. So I say we, like I was part of the founders of the program, but I'm very proud of it. And I at Zambia Neurology, we have graduated 18 neurologists, and I was the 7th one. And I think people are beginning to notice and see the impact of having neurologists in the country, especially with epilepsy itself and other neurological disorders that are some actually were thought not to exist in our region, but with neurologists we're actually diagnosing these diseases like multiple sclerosis. And even with epilepsy, now that we have neurologists, in terms of advocating for better services, better anti-seizure medication, I think now we have a voice. We're not where we should be, but I think we're headed towards that direction.
What is it like regarding education of the epilepsies in general in Zambia? And I mean, education of people in general, as well as, members of parliament, for instance.
We have a lot of work to do, and not just epilepsy, but brain health in general. So with regards to epilepsy, it was in my curriculum in medical school. Not a big part, unfortunately. It wasn't such a big component, but we did have some epilepsy training as part of the curriculum. I talked about not having neurologists. So for some time, epilepsy was under the psychiatry department. So we have health workers called clinical officers here. They are clinicians, but they're not like doctors. So they're those who would specialize in general clinical officer program, and those who would specialize in the clinical officer psychiatry program. And those are the ones that actually had a bigger component of epilepsy training. And those are the ones that took care of most of the patients with epilepsy. And even now, because even if we have about 17 neurologists who are mostly in the urban areas, so the rural areas still are seen by this clinical officer psychiatry. So they are under mental health. Of course, it doesn't do much with fighting stigma. But for now, these are the people taking care of people with epilepsy in the rural areas, in the outskirts. When they are in the big cities where they're neurologists, of course, we try to look after them. The sad part is even doctors who are not specialized, general doctors, they wouldn't really look after patients with epilepsy. They'll still refer them to the mental health department. So in terms of fighting stigma with regards to treating people with epilepsy as if they have mental health problems, we're not where we want to be, but we're hoping that with the increasing number of neurologists, we can get back this population and even just encourage the medical doctors to say it's a neurological disease, just like they would treat malaria, just like they would treat HIV, hypertension. Treat epilepsy.
Talking about, I guess, kind of cultural beliefs and stuff, because this is very impactful. I hear that you have traditional healers in your country. How do they work with you, or do they? And what is the influence of them upon things like stigma and treatment for the epilepsies?
We have people, not just in the rural areas, even in the urban areas. We have people who have so much faith in the traditional healers. I think this is deep rooted in cultural beliefs. Especially with the myths that epilepsy is associated with witchcraft or demon possession. So they'd rather go to traditional healers who are thought to, deal with people who are possessed or witchcraft. So people would go there, and traditional healers are trusted people by members of the community. But this should not be a disadvantage. Of course, them going to traditional healers first delays the diagnosis or even the treatment. And by the time the traditional medicine fails and somebody actually comes to the modern care, the health facility, maybe the disease has progressed, they have other comorbidities or even injuries from lack of seizure control. But I think traditional healers can be harnessed, if I can use that word. We can collaborate and bridge this gap. I look at it as an opportunity. If we get traditional healers on board to recognize early symptoms or signs of epilepsy and refer them to the health facility in good time. Of course, it will mean they are losing their clientele, but we see how we can work together.
Clientele.
they're gatekeepers of health services in their communities because they are so trusted by the local people. So if we can have this campaign where we bring in the traditional healers, tell them about epilepsy, how to recognize it, and refer the patients early and bring them in even in the awareness campaign, I think we can work with them. It's a very good opportunity that we have.
It sounds very positive, and you're very involved in these awareness campaigns, aren't you? Like the International Epilepsy Day or Purple Day or anything to do with ILE, yes, or IBE. I get the sense there is a lot more that needs to be done day to day, your side, and you've been involved in a sort of more frequent media interviews and stuff.
Yes, actually the reason I decided to do neurology or become a neurologist was because of epilepsy. I was so interested in epilepsy from the time I was just a junior resident medical officer. It's a passion. I love talking about epilepsy. I love raising awareness. And it's because, when we look at neurological disorders, Torie, some are very progressive and there's nothing much you can do about them. Somebody with epilepsy has a chance of having their seizures controlled. Of course, there are those with drug resistance, about 30%, but the 70% can live a normal life with just somebody giving the correct diagnosis and the right treatment. So when it comes to neurological disorders, epilepsy is one of those I love to talk about because the people have a fighting chance.
Yeah, and it means the families also have a fighting chance as well, because it's not just about the individual with the diagnosis. And so, to end on a very positive note, tell us about your planned epilepsy registry.
Okay, so currently in Zambia, we don't have a national epilepsy registry or a robust, comprehensive surveillance program. So I thought if we start with the registry, and I'm looking at 3 major institutions here in Lusaka, the capital city, where I work at Levi Mwanawasa University Teaching Hospital. And then we have the mental hospital, Chainama, because they still have a population of people with epilepsy that they see because of the comorbid conditions, depression and all. And then also working with the other tertiary institution where I trained from, where we also have neurologists available. So these 3 areas, if I could have these 3 institutions to have a pilot of that registry, if I do it well, and then we can roll it out in the centers where the neurologists outside the capital city, if that works well, then have a countrywide registry. So I have it figured out in that stepwise manner.
I love the sound of it. It's taking as much control as one can. And then I suppose you're going to present this information to members of parliament to actually, you'll have statistical, empirical evidence for them to note and take action upon.
Yeah, that's a plan, dissemination, especially to policy makers. So for now, we have the IGAP. It's been 3 years since WHO launched the IGAP, but we don't have, how can I put it? We have not really implemented it in Zambia. So we're still, I could say we're still at a stagnant phase where we were even before the IGAP, but it is promising because now currently there's something that we're trying to work on with WHO. I won't go much into those details, but it's very promising, and I'm hoping after this project people are going to benefit from this project and learn more about epilepsy. There's some works we've done with the Epilepsy Association of Zambia. There's a study we did. We went into schools, just trying to gather some data, talking to parents and caregivers and to teachers about epilepsy. We did focus group discussion involving those parents whose children are still going to school and those parents whose children are not going to school, maybe because of the diagnosis itself or the poor seizure control and they're out of school. So we had surveys, questionnaires asking them and also educating them that once they are on medication and their seizures are controlled, they can go to school. They have so much potential. We have examples of celebrities that have epilepsy and have made it and are thriving, even in very big professional careers. So it's also possible if they still allow their children to go to school. The key is to get them on medication, the right medication, so that the seizures can be controlled. And of course, for those with difficult to treat epilepsy, to have them seen by specialists and see how they can be helped, and also integrating these children into the ordinary schools with other children to have this interaction. And we've also talked to teachers. So now the IBE, that's the International Bureau for Epilepsy, they've got this teacher's guide on how to handle children with epilepsy. So we launched this with the Epilepsy Association of Zambia. It was very successful. We gave some copies out to different primary schools so that teachers know how to recognize when a child is having seizures, what they should do when a child starts fitting in class, and not just for the children with epilepsy themselves, but even the friends, so that they know what's going on. And they should not fear, because this is where stigma comes in. Once the teacher shows fear, doesn't know what to do, that's what the other children get, and that's where stigma starts from. So educating the teachers, and then they know what to do, and also educating the other children that they are just normal children like them. They're not defined by their disease.
Naluca Beckford. Her knowledge, strength, resilience, and her positive persistence is and shall continue to change the lives of those in Zambia for the better. Learn more about Naluca and her work on the website torierobinson.com, where you can access this podcast, the video, and the transcription of the entire episode all in one place. And if you're new and you haven't done so already, please do like and comment on this episode and subscribe to our channel so that we can get way more people learning about and having a better and a factual understanding of the epilepsies. See you next week.